Hello, ladies and gentlemen. Today we are discussing with Mr. Labram Musah, the Programs Director of the Vision for Alternative Development in Ghana and National Coordinator, Ghana NCD Alliance. He works to implement the tobacco control measures in Ghana's Public Health Act passed in 2012. His efforts contributed to VALD winning a 2013 WHO Award for Excellence in Tobacco Control. Welcome, Labram.
Thank you very much for having me.
Okay, let's start with an overview of the tobacco control landscape in Ghana. Briefly describe how that looks at the moment.
Thank you very much. Tobacco, but currently the country is implementing an ad valorem tobacco tax system, which obviously we all know is practically not the best in terms of advancing the public health goods, and reducing the incidence of tobacco-related diseases. So just briefly, if I'll take you back, so in 2007, before Ghana was implementing the ad valorem, then from 2007 downwards to 2010, Ghana, started implementing the specific tax, system. Then, for whatever reason, which of course some of us are aware of, Ghana then moved from specific to again to start implementing ad valorem tobacco taxation. Even though research, currently tells us that when Ghana, tried to implement the specific tax, the results were just so phenomenal. The revenue that government was generating was so huge. But because, government was not looking at tobacco or cigarette as a product on its own, but was looking at all other non-petroleum products. So it shifted all products from, so when it moved, it didn't move only tobacco or one particular product, it moved all other products. So, and then research is saying that we need to actually look at the benefit that that Ghana actually, got as a result of moving from ad valorem to specific tobacco products. So currently, Ghana is doing 175%, ad valorem, and of course, and this happened since 2015, and to date there hasn't been any tax increment about tobacco products. And you and I know that this could be one of the reasons why we still have tobacco products very cheap in the market. If you have $1, you can purchase a pack of 20 cigarettes, which will cost you, like I said, about $1. If you have $1, you can purchase at least 3 packs of cigarette products, which makes tobacco one of the cheapest products in the market. So briefly, that's an overview of tobacco in terms of tobacco taxation in the country.
Okay, thank you so much. We want to talk specifically about tobacco taxation in Ghana today. Recently, VALD and some partners launched the study reports on the economics of tobacco taxation and control in Ghana. Tell us more about the conclusions and recommendations of that report.
Right, so thank you once again. This came about as a result of the fact that, as I mentioned earlier, since 2015, Ghana have not had any benefit of tobacco taxation, making tobacco one of the cheapest products in the market. And then also the fact that the prevalence of tobacco-related diseases are also growing or are on the rise. So we thought that there's a need to begin a campaign. So the campaign started, and you definitely always will need data to back or evidence to back your advocacy, because that has been the argument of policymakers that we need to have data to support our call for tax increment. So with the support from the Tax Justice Network Africa, we began this process to come out with a study. And then the study actually, came out with key findings, and some of the findings included the fact that there is, even though there's a decline, in smoking, especially in the southern part of the country, there has been a rise in products like shisha, which now the youth are into, and then also the fact that flavored cigarette is more or less like the order of the day, because we have also recorded that currently Ghana is also importing flavored cigarette like the menthol, which is more flavored, and people are quick to use that particular product. And then also the fact that we also do not have, Ghana is no more producing tobacco products, but we get our products from our neighboring country, from Nigeria, which of course, because of that, there are some tax waivers because of trade liberalization, among the West African sub-region. And then also it also turned out that currently there are over 21 brands of cigarettes on the markets of Ghana, and some of them are illicit tobacco products, from our neighboring countries. And this also adds to the problem that we are having currently on our hands. And then one of the major findings also is to the effect that cigarettes are still sold in single sticks, and that's one of the major problems, even though our law has clearly outlawed the fact that you cannot sell cigarettes in single sticks, So these are some of the key findings, and then also the fact that Ghana is implementing an ad valorem tax system, which is not helping us to advance, the issue of tobacco taxation, and then also the fact that currently Ghana needs a lot of revenue. So there's a need for us to begin the discussion towards that. So this was some of the key findings from the report. Some of the key recommendations. One of the topmost is the fact that Ghana should move from our current status, and then look at other best practices, like like for instance, moving from the ad valorem to a hybrid of the two, or specifically we should look at specific taxation of tobacco products. Now, and then WHO is recommending strongly that countries should gear towards meeting the WHO benchmark of 70 to 75% of the retail price. And then, but currently Ghana is doing about 32%, which is far below the WHO benchmark. And then also, currently we are also aware that the ECOWAS directive of 2017, specifically on Article 6, also, call for member countries to, as much as you can, adopt a mixture of the two, which is the specific and ad valorem. So that's one of the key recommendations we have made to government. And then also, we are also calling for, so this is one of our major calls to government. So, and then there's a research that has been done, including modeling by the University of Ghana, which clearly has shown us that when Ghana implements or when Ghana imposes at least about $1 or $2 on tobacco product, and if it is either specific or a mixture, the revenue that government is going to generate will be overwhelming. And then also looking at the fact that government need to up its game in terms of collaborating with civil society organizations to advance awareness creation and on tobacco product, because having law alone will not work, but of course you need to advance awareness creation among the population so that they can begin to understand that tobacco is an injurious product that they need to stay away from, so that they can live a healthier life.
Okay, thank you so much. So what do you see as the way forward for the tobacco taxation in Ghana?
I must say that government have received this document in joy, because they said this is what they were actually yearning for, and they are grateful that society have been able to come up with such a study that is telling them how much they are going to get in terms of revenue if they impose a percentage of, or a particular percentage on tobacco taxation. And then also the fact that we've been talking about changing the tax regime from ad valorem to specific or to hybrid. And in fact, they're also happy that they have got enough reason to change from where we are to a more specific or a hybrid of the two. Taking cognizance from other best practices like countries from the Gambia, Seychelles, and then also South Africa, and then you can also mention Kenya, that is currently implementing either a specific tax or a hybrid of the two, and a lot of benefit that they are kind of benefiting. So the government is happy about the results of our work, and they intend to consider these findings as the rollout discussions on our next budget. So we are also waiting to engage governments to further implement some of the key provisions that our study revealed.
Well, thank you very much, Mr. Labram, Programs Director of the Vision for Alternative Development, for enlightening us on the tobacco taxation situation in Ghana. And congratulations you for your efforts to build a healthier, tobacco-free Ghana. We pray that these efforts continue to yield good results.
Thank you very much for having me, and grateful for the opportunity.